film we're going to look at back pain, how you can prevent back pain and how you can help to ease it and to make it better. First of all, we need to think a little bit about how your back is actually constructed, how your spine is put together, because then you'll have a better understanding about why certain things are bad for it and certain things are good for it. So your spine is made up of vertebrae of bones which sit on top of each other, one on top of the other. And to keep them straight and in balance is really important. It's a little bit like the foundations of a building. If you've got the foundations of your building or the brickwork a bit wonky, the building wouldn't function very well. So that's the first thing. Alignment is really important for your spine, so that each of those vertebrae sit nicely on top of each other. And then in between each vertebrae, there's what's called a disc. And a disc is actually, the best way of describing as a disc is a little bit like a donut. So it's got a fibrous, like the dough on the outside, outer part, and in the centre, there's a gooey jelly part, a bit like the jam. Now, as you move your spine backwards and forwards and side to side, obviously the bones are moving on each other, and that disc is squidging around in between. Now, if you imagine, one of the main causes of back pain is bending forward like this, and even worse, bending forward with a twist. Every time you do that, your vertebrae, if you can see, imagine this, sitting on top of each other, as you bend forward, they compress towards the front of your body and they push the disc backwards. And every time you do that, you're pushing the jelly into the back of the disc, and over time, that can bulge and it can start pushing out. And as you're probably aware, there are lots of nerves that come out from your spinal cord through between the vertebrae, between the bones, and the disc can start to press on one of those. And that's one cause of what we call sciatica, when you get pain going all the way down the back of your leg. Sciatica can also be caused just by overstraining the muscles. Now, these muscles in your back here are actually, if you feel them, they're actually quite small, the ones that run either side of your spine, whereas these muscles in your thighs, around your legs, are really big. So these are the muscles that you're meant to use to lift your body, not these. If you try to bend forward like this, you're taking the whole of the top of your body, the weight of the top of your body, on just these tiny muscles. Whereas if you squat down and you use your legs, these are your lifting muscles. So that's the first thing to remember, is your back, your lower back here, your lumbar spine does not like bending forward because it pushes those discs backwards and weakens them, and it overstretches these rather small muscles which aren't able to support the whole back. Your upper body, with your head on the top, weighs a lot. It's, probably about 2/3 of your body weight, and you're trying to lift that long lever on some very small muscles here. So the first thing, once you understand the anatomy a little bit and how your back works, to remember is to look after your back. Always bend your knees and do your lifting like that. Take something close to you. So if you want to lift up a toddler, or if you're lifting up a box, bring it close to you because that shortens the lever, it makes it easier, and push up with your knees. Don't use your back because that's going to tear these muscles, which will give you back pain. When those muscles are torn, they can press on nerves, and that can also give you sciatica. And in a slightly worse case scenario, it will push the disc backwards, and that then presses on the nerve. So the first bit of back care is always use your knees. Try to avoid bending forwards. Now, there are some simple remedies if you have got back pain. First one is to make sure your posture is good. So stand up nice and tall. Just start by feeling your feet on the ground. Feel them really nice and evenly on the ground, so you're not slightly favouring one leg or a little bit step forward. Your feet need to be even on the ground. Feel weight going smoothly through them, really evenly through them. And then all you're going to do is imagine you've got a little hook on the top of your head, and it's just pulling up. So don't throw your head backwards. Don't do that. It's just pulling up. Drop your chin a little bit. Let your shoulders relax. And as you do that, your abdominal muscles, your core muscles will start to work automatically. So go back into your normal posture, slumped a little bit. Feel your feet rooted on the ground. Pull up from that top of the head. Drop your chin, drop your shoulders, and you will always feel, without you having to do anything, it just happens automatically. Your spine is getting longer, and your abdominal muscles are starting to to work. Now, obviously, you're not going to walk around very rigidly like that, but if you do it a little and often during the day, if you've got quite a standing job, or even if you're sitting at your desk, stand up nice and tall, and that will strengthen these muscles, and they'll start to open up your chest and come in without you having to think about it. So you don't have to hold that very stiff posture, but just practice it every so often. Feet rooted, pull up from the top of your head, drop your shoulders, drop your chin, and you'll feel this area starting to work and your spine getting longer and coming back into a better alignment. So that's the first thing that you can do, get your posture right. The second thing you can do is move. Your spine and all your muscles generally just don't like to be in one position. Now, we're quite self-conscious sometimes about moving, so it's really nice just to stretch to begin with. Have a good stretch around. Just get everything moving. Your spine likes to wriggle about, helps with the blood circulation, it loosens the muscles, it warms things up, helps things relax. So this is a nice one to start with. You can do this if you're, whatever you're doing, waiting for a bus or going for a walk or sitting at your desk, you can just stand up and get moving. And then the next one, which is really nice for your lower back, is to put your hands flat on your lower back like this and just rotate your hips. We've got a pair of dog's ears at the bottom of the screen at the moment. He's just intrigued by what we're doing. And then change direction and really try to get your hips moving. This is such a good exercise to do if you've got back pain and you just want to loosen things up, get the blood circulating a bit better. Good. And then have another stretch up and around and back. And give your legs a bit of a kick out. We're quite static with our lives at the moment. We tend to go to the gym or go for a walk and then keep ourselves quite still. The other thing that your back really likes is extension. So the opposite to forward flexion. So bending forward, it likes the opposite, it likes this. Your lower back, because that, if you remember, the discs as you bend forward get pushed into the back and push against the nerves. As you take your back backwards, these vertebrae, the bones go backwards, they actually push the disc back into a better place, and they help those extensor muscles here to get a little bit stronger. So putting your hands on your hips and just arching backwards. Don't throw your head back, keep your chin tucked in and just arch back. And very often if you've got back pain, a sciatic type pain, that can just take the strain off the muscle and then off the nerve. So if you had a long car journey, if you've got to sit, say, in the theatre or at a meal, or you're sitting at work, every so often just stand up, put your hands on your hip, and just stretch backwards. So that's a nice exercise to do, and then you can come back into a little bit of hip circling. Now, the other exercise, next exercise I'm going to show you is pelvic tilting. And you can do this in sitting and in lying. So you're going to sit, imagine you're sitting at your desk, you're working away, or you're sitting at a meal and your back's a bit sore. You're just going to slump down and sit up tall. Slump down. Can you see my pelvis is rocking backwards and then it's rocking forwards. Sit down, slump and sit up tall. Slump and sit up tall. Slump and sit up tall. Your back really likes that movement. You can do it when you're driving, you can do it at work, you can do it in the evenings when you're just relaxing. It's a great one just to loosen up. It might be a bit sore at the beginning, but if you keep going just for maybe about 20 or 30 of them, it will loosen up. The other one it likes is just going a little bit side to side, leading with your shoulder, just gliding. This just helps again those vertebrae, those bones loosen up a little bit. So that's another nice one to do. So if you're sitting a lot, remember pelvic tilting, sitting up tall, slumping down, sitting up tall, slumping down, and then standing up, having a bit of a hip circle. Get that all moving, and then putting your hands on your lower back and arching back, tuck your chin in and arch back. So those are really good simple back care. You can remember, always have a bit of a stretch, a bit of a loosen out. Now there are one or two things that you can do in lying as well. So I've got my mat here. Just going to move this chair right out the way so you can see. Now when you come down onto the floor, come down onto your knees. Go down onto one elbow side and roll back onto your back. Have your knees bent up. And in line as well, we can do that pelvic tilting, just rocking into the bed, into the mat, and away from the mat, into the mat. So I'm pushing my lower back into the mat, and then I'm rocking away, and I'm making an arch under here. My pelvis is rocking forwards, into the mat, away from the mat, 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 into the mat, away. Good. Then you can relax for a moment. And the next one we're going to do is knee rolls. So you're going to put your knees and your feet tight together. And you're just going to let your knees drop over to one side. It stretches, your backside comes off the mat, your shoulders stay on it. Stretches into your lower back nice and slowly, don't do it fast. And then if you want to, you can take the top leg over. And you'll feel that adds to the stretch. Relax there for about 10 seconds. And then your knees and your feet come back together. Roll back through the centre line. Now don't move your feet around, keep them in the middle. Don't move your hips, leave them where they are. Roll all the way over the other way. And take that top leg over. Keep your shoulder down and relax into that stretch for about 10-15 seconds. Learn to feel what your body needs. Don't rush it, just learn to feel what it needs. If it's comfortable, leave it a little bit longer. Let you totally relax. And then again, knees and feet back together. They roll up to the centre line and come back into the middle. You can do it with your arms out at 90 degrees. That will take the stretch slightly higher into your back. So again, we're going to go all the way over. Take that top leg over. Relax into the stretch. Bring your knees and feet back together. Don't shuffle your feet or your hips. Straight over to the other side. And relax. And back to the centre again. And feet a little bit apart now. And a bit more pelvic tilting. Rocking backwards and forwards. Now I'm just going to show you one more thing in line. And that's your bridge. So a lot of people, when they do a bridge, just come up like this. And the belly stays a bit relaxed. When you do a bridge, you need to tilt your pelvis right back. So I'm pushing my lower back into the mat. I'm keeping it tilted back, and I'm coming up very, very slowly. You can see my backside, my hips just lifting up, and I've got to keep tilting back, keep pulling the pelvis back. So this gap between the top of your pelvis and the bottom of your ribs gets smaller, and you'll feel your belly getting tight, not on the outside, your big abdominals, but on the inside, so your core muscles. And you're just going to hold it there. Now if I go any higher, can you see I can't keep these working? But if I drop down a bit, I can keep pulling back the pelvis. So as soon as I get to this point, my glutes, backside muscles here are working very hard. Quads are obviously working, my hamstrings here, so either side of my thighs working, and I'm pulling back very hard with the pelvis. And if I go too much higher, the pelvis, I can't keep it pulled back, and I lose that core. So you're just going to stay there and hold it for about 20 seconds. And slowly curling down again, and then rock forward and rock backwards. So that's a nice core exercise to do. Now the other thing that's quite nice to do on the floor is just lie out flat and just relax. Let your body find its own, settle into its own space. Bring your knees up. You can bring one knee up to your chest, give it a good hug. Bring the other knee up to the chest, give it a good hug. Pop those down again, just nice to stretch your knees the other way, your back the other way. And then we're just going to roll over onto your side, come up, and you're going to come onto all fours this time. And you probably know if you've done any yoga, this is cat-camel, cat-cow. Let your backs drop down. This is again pelvic tilting, but it's on hands and knees. and arch up, walk down, arch up, walk down, arch up, walk down, arch up. Good, and then you can come back up from there. And as you come up, just have a bit of a stretch back, and again a bit of a hip circle. So always move your back. If you've got pain, try and keep things moving, because that helps the circulation, it helps the healing, helps move things around. What we tend to think is if something's painful, we've got to hold it still. It's very important to move it, but move it safely. So don't do any bending forward. Don't do these twisting movements. Don't sit for too long, but do stand up nice and straight, feet rooted, pulling up from the top of your head, and then do some of these movements, either this one, or arching back, or some pelvic tilting, to try to get the blood moving, to loosen those joints up, to loosen the muscles up. It's a little bit like a rusty piece of machinery. You've got to get it all loosened up, and that helps that area go back into the right positions and heal up. The other thing, last thing I'm just going to say for back pain is, do keep practicing this one. Just going down onto the floor and being able to get back up again. That is really important. You need to keep these muscles strong. So you can either do squats, come down like this, and back up. Just do four or five of those. Oh, and one more. And then do go down onto the floor, because if you've got to tidy things up or pick things up, you need to do it from down on the floor, and these muscles have to stay strong. So as well as protecting your low back, you've got to keep the rest of your body as strong as you can, the muscles that you need to use. And certainly if you're doing a lot of desk work, if you're getting a little bit older, it's these muscles that go, and then you end up doing things wrong, and you end up injuring your back. If you need any advice, if your back is really acutely painful, definitely contact your GP, find a physio or an acupuncturist who can treat you, who understands backs very well. There are also more videos on my YouTube, Apothecary NHC, which will show you more exercises that you can do, other stretches that are useful for your back. Thank you very much, and good luck with your back.